I would first of all like to apologize for my absence. I could not make it due to personal reasons. I would also like to thank the scientific committee of AIOS for giving me this opportunity. My topic is when to add an anti-VEGF agent during cataract surgery. Now, cataract surgery is one of the most common surgical procedures, and 20% of patients who undergo cataract surgery are diabetics. Now, among these diabetics, there we come across five situations. That is, diabetic patients who have no retinopathy, those who have retinopathy but no DME, those with DME who are not have not been on treatment, those with DME who have previously been on treatment, and of course PDR with cataract. Now, those with have no DME behave very much like the non-diabetics. The macular edema, however, has been reported to increase by about 11 to 30% in about 22 to 25% of diabetic patients following cataract surgery. The incidence of post-op cystoid macular edema is higher in diabetics, uh, even those who do not have diabetic macular edema. Chia and Hasu, in a meta-analysis, showed that topical NSAIDs was better than anti-VEGF agents at 3 months in terms of macular thickness. So these patients would probably require NSAIDs uh, following cataract surgery. This is a patient who had cataract surgery in both the eyes, came with post-op CME in both the eyes. You can see in the OCT, there is central uh, thickness with cystoid edema in both the eyes. Note, however, that there are no diabetic changes in both the eyes. So this would confirm that this is a post-op CME. And after treatment with topical steroids and NSAIDs, there was a good resolution with good visual recovery. Those who have retinopathy but no DME, they have also an increased incidence of post-op CME. Now here comes a question that has there occurrence of diabetic macular edema following cataract surgery? A good clinical examination can help because you can look for hard exudates and microaneurysms. And OCT can show whether there are certain additional features of DME in addition to the cystoid spaces in the center. The OCT-A can help in differentiation. However, FFA is a confirmatory test. Now, the major group of it is also those who have diabetic macular edema and significant cataract. Now, there was a meta-analysis done by Matteo who showed that cataract surgery with anti-VEGF or DEX implant showed good improvement in visual acuity and reduction in macular thickness. The DEX implant, however, had a greater reduction in the macular thickness. Lia Kwan Zhao showed that patients with diabetic retinopathy with or without DME had good reduction in macular thickness and improvement in vision with anti-VEGF treatment. Now, in these patients who have DME with significant cataract, should we pre-treat with anti-VEGF or can it be done